Hi, welcome to a special NBA Finals episode of Talking with Docs. I'm Dr. Brad Wiening.
And I'm Dr. Paul Zalzal, really, with the cap. It's giving it away here.
A little bit of a homer. So obviously in the news yesterday we found out that Kevin Durant did have an Achilles tear, not just a calf injury, and went on to thankfully have successful surgery, and we're here today to break it down, talk about his recovery and his potential future in the NBA.
Kevin, get well soon. We enjoy watching you play.
Absolutely. Generational player. Definitely want him back on the court. So a lot of controversy about whether or not he should have gone back. I think that has been debated to the nth degree, and there's no way. Obviously he got injured, so maybe he shouldn't have played.
Yeah, I think that debate is answered now.
Yes.
Went back too soon, period.
Next decision was whether or not to have surgery, and I think a combination of his re-injury plus his elite athlete status probably pushed the envelope a little bit to say, hey, let's get it taken care of quickly.
Achilles tendon rupture, you can treat it operatively or non-operatively. My winter sport is snow blowing the driveway.
Yes.
My summer sport is mowing the lawn.
Yes.
So someone like me would do just fine with non-operative management.
And we have a video that talks about that, kind of the more average person.
We'll put a link at the end to that.
In my clinic, I do see a lot of NBA players.
Yeah. I can see them ducking to get in the doorway.
Right. So, Paul, what exactly happens when you have Achilles tendon surgery? What's the nature of the surgery?
Well, your Achilles tendon is ruptured, so it's pulled apart, and the nature of the surgery is pretty straightforward. We just sew the tendon back together.
Right.
Earlier he had a calf muscle tear. You can't really sew the muscle back together. There's nothing there to hold a stitch. But in the tendon, there's a lot more collagen there, and you can actually get a stitch in there to hold the tendon together.
And I think that's what's hard for the average person to understand, that as your calf becomes the tendon, the calf is all muscle, and the tendon is one of the strongest tendons in the body. But where they join, it's called the musculotendinous junction. This is usually where the tears occur, about 3 inches from the heel. And that is an area that's a little bit funny. And I liken it to try to sew a hamburger to a belt. Because you just can't, it's very difficult to do. So the stitches up into the muscle actually are like lassoing it. It's a special technique called the Kessler suture technique, where you kind of wrap it around and pull it down.
Right, okay. So you've done that surgery. I've done that surgery.
We've all done it.
It's not rocket science, that surgery. There's a few technical challenges that you have to be careful for, but it's a common procedure. So the outlook is good for him. It should heal. It should heal intact.
And I would say yes. So the success of the operation, if your measurement is just healing, I think is almost universal.
Right.
Risk of re-rupture, we've talked about before, surgically is about 5%, which is thankfully uncommon. But it's the recovery that's going to be a bigger part. So what's his early post-operative phase look like, Paul?
So first thing, you have to immobilize this tendon so it can heal. And you want to immobilize it with the toe pointed down so that you're not putting any tension on that tendon. Okay?
Right.
Because the Achilles tendon is in the shortest position when you're pointing your toe down.
And that could be either a calf or a commercially available splint. We happen to have one here.
Okay, let's start with straightforward boot. You could go into something like this. Okay, It's quite rigid. It's like a cast, like a ski boot. But you can put it on, take it off, and
right now his foot is at 90 degrees. We want his toe down a little bit more. So there are some adjustments that you can make inside of the boot, this little wedge that's angled, to allow less stress to be on the newly repaired tendon or even a non-operative tendon.
It's like a high heel shoe from the 60s. You put that inside the boot, and that'll keep his toe pointed down. Other option?
Other option is an adjustable boot. It's called an MC walker. So we've set this at 0 degrees of what's called dorsiflexion, so the toe can't go up, but actually you can allow it to bend down. The boot is adjustable.
So the toe can go down, can't go up.
Because the most dangerous move for an Achilles tendon is that abrupt dorsiflexion, or toes to the ceiling. It stretches it and could theoretically stress or rupture the repair.
This is the way I do it. I lock that with the toe pointed down for the first while, then gradually bring the toe up.
Exactly.
And then lock it so that it can plant or flex, but it won't go back beyond neutral.
What about weight bearing, Paul?
Well, you can weight bear. Once you get the foot to 90 degrees, you can weight bear as tolerated. It's a little tricky to weight bear when your toes pointed down.
Yeah.
You can do what you can, but really once you get your ankle back to 90 degrees, which for me is about 4 to 6 weeks out after the repair or injury.
I would agree, and depending on the repair and the surgeon and the strategy, it might be a little bit sooner, but yeah, period of non-weight bearing and then physiotherapy, not only to slowly stretch out that tendon, but then really to work on strengthening those calf muscles.
Okay, the $1 million, or actually $200 million question is, when can you return to basketball?
Okay, so normally I would tell my patient in the clinic 6 to 12 months for like running. If I had like a weekend jogger, 6 to 12 months.
Yeah.
What do you tell your patients?
Same. I say the same thing, about 6 to 12 months. When I tell people, and we mentioned in our Achilles tendon video that you can watch after this, We want to make sure you get the full range of motion back and at least 80% of the strength back. But this is like Joe average. Now, an NBA player, my guess, I'm saying 1 year.
Okay, so your guess is based on actually a fair bit of fact. So they've looked at, say, the last 15 or so people that have done this, and the average time is about 1 year. The three most recent and probably most acknowledged people that have had this procedure done recently would be Kobe Bryant, Rudy Gay, and DeMarcus Cousins. So I looked into it. Kobe Bryant actually had a very good year the year after his tendon was repaired, 27 points a game. He did retire 3 years later, probably because he was a little bit older than Kevin Durant. He was almost 5 years older. DeMarcus Cousins injured his Achilles last January, returned 1 year later, and as we've seen in the playoffs, he's obviously a very large, dominant player, but has lost a little bit of his step, and that may come back. And then Rudy Gay was one of the fastest people to ever come back. He came back after 9 months, and in his first full year of stats with San Antonio this year, his shooting percentage went up from 3 as well as from the rest of the field, but his minutes and his points went down about 20%, from 17 to 13 points a game. So I think most people would say, I'll take Kevin Durant at 20%.
Oh, yeah.
And what I would say is I think he is not a normal human being. So if anyone is going to beat the odds, I think it's going to be easy money sniper.
I'll take Kevin Durant wearing this thing on the court.
That's right, depending on the team that they're playing against, for sure. Any last minute tips, points, viewpoints?
No, that's it. A lot more detail in our Achilles tendon video, which I will provide a link for.
I think the return to sport video too, obviously elite athletes return at a different rate than the average person, but I think care and common sense, you want to go back slowly so that you don't suffer something more significant.
I can guarantee that he's not going to come back too soon this time.
No, maybe then next season, maybe for the playoffs, time will tell.
Okay, Kevin, man, get better quick. We love watching you play.
Absolutely. So, and if you like this video, please like it, subscribe to our channel, leave us a comment about the injury or the playoffs, whatever you want.
And remember, you are in charge of your own health.
We'll see you next time.